Social policy comprises the programs designed to improve Americans' quality of life, particularly for those who can't fully provide for themselves through market participation. The American social safety net isn't a single coherent system, it's a patchwork of programs built at different moments in the 20th century in response to different crises with different eligibility criteria. Let me walk you through the major components. A critical distinction first: means-tested programs versus social insurance entitlements. Means-tested programs require beneficiaries to demonstrate that their income or assets fall below a specified threshold. These programs are targeted at those most in need, but they carry a social stigma in American political culture that entitlement programs do not. Entitlement programs are universal or near universal, available based on age or work history rather than need. On the means-tested side, TANF, the Temporary Assistance to Needy Families program, replaced AFDC after the welfare reform legislation of 1996. TANF provides block grants to states, imposes work requirements, and caps the federal financial commitment. SNAP, the Supplemental Nutrition Assistance Program, is the largest federal food assistance program. About 40 million Americans receive electronic benefit cards at an annual cost of roughly $100 billion. The Supplemental Security Income Program provides cash assistance to low-income elderly, blind, and disabled persons. The Earned Income Tax Credit is a refundable tax credit for low and moderate income workers that has become one of the most effective anti-poverty programs in the federal budget. And Medicaid is the means-tested health coverage program for low-income Americans. Now, the social insurance entitlements. Social Security was created by the Social Security Act of 1935 during the Great Depression to provide retirement income to the elderly. It operates on a pay-as-you-go basis. Workers and their employers contribute payroll taxes during their working lives, and those taxes fund the benefits of current retirees. Social Security is the largest federal spending program, distributing roughly $1 trillion annually to about 65 million beneficiaries. Most Americans regard it as an earned entitlement, something they paid for through decades of work, which is exactly why it's politically very difficult to cut. The long-term fiscal sustainability of Social Security is a persistent concern. The trust funds are projected to be depleted in the mid-2030s unless Congress acts to increase revenues, reduce benefits, or some combination. The political difficulty of either raising the payroll tax, increasing the retirement age, or reducing benefits has produced decades of legislative paralysis. Medicare, created in 1965 as part of LBJ's Great Society, provides health insurance for Americans 65 and older regardless of income. Medicare spending exceeds $800 billion annually and is projected to keep growing. The 2003 Modernization Act added prescription drug coverage as Part 500, and Medicare Advantage allows beneficiaries to receive benefits through private insurance plans. So the safety net is layered: universal entitlements for the elderly and disabled, means-tested programs for the poor. Both are politically essential. Both are politically contested.